Welcome to Stadium View Home Health. This is my patient Olivia. I've already introduced myself. She's in for low back pain. So first we're going to talk about, I'm just going to give her an opportunity to open-ended discuss her pain, causes, what makes it worse. I'm going to ask pain descriptor questions. We're going to talk about her past medical history. I'm going to ask her red flag questions, history of cancer, night sweats, night pain, loss of weight that can't be explained, things like that. I'll get a medication list from her. I want to know if she's taking anything to control her pain, as well as other medications that might be contributing. So I can go ahead and start off with, I'll just do like a combined range of motion and manual muscle testing screen in this position. The ones that I can do in this position. I'll do sensation testing. I'll go through each dermatome, and then I'll do a DTR test. So now on to the actual examination as far as the lumbar goes. We'll start off with the slump test. So Olivia, I'm just going to have you scoot a little bit to the edge. Thank you. So now I just want you to get like the worst posture, terrible, just slump those shoulders. Good. You go ahead and bend there, sit next to you, and just relax. I'm going to extend that leg out, okay? You tell me if you have any pain at any moment, all right? So I'm going to just passively extend that leg.
My hamstrings a little tight.
I can feel it. So she was able to identify the pain right there, and I was actually able to feel it as well. If she had pain at any moment, I might drop the leg below if we couldn't identify if it was hamstring, and I could go ahead and dorsiflex the foot as well to identify that it's sciatic pain. What? So I would ask her pain descriptor questions. She already told me my hamstring was tight. If she just said pain, I might ask, does it shoot down the foot? Is it really sharp? Is it a tightness? Things like that. So I could also do the Kemp's or lumbar quadrant test in this position. So I'm going to go ahead and do that. So Olivia, what I want you to do is just go ahead and extend that back. And then I'm going to have you bend this way and then rotate away. And I'm just going to put pressure. Let me know if you have any pain, okay? So I'm going to push down. Any pain? No. Okay. So I would do that for both sides. If she had pain on this right side for that test, then I would suspect maybe facet pain. And if she had pain on the left side with that, then I'm looking probably muscular. So while on this test, I go ahead and do some PIVMs. So Olivia, I'm gonna kneel down right here. We're gonna do the best we can. You scoot towards me. Okay. So what I want you to do is just relax your head on my shoulder. Good. I'm gonna lift that shirt up. Okay, so I'm gonna support her and go ahead and relax into that low back. Relax. She doesn't want to relax, she never does. So I like to go ahead and find that PSIS and scoot over, and I'm going to know that I'm at L5. And I'm going to put my fingers on L5 and L4. I would also test S1, of course, too. And I can go ahead and do flexion, relax, good. I can do extension. I could do rotation. I could do side bending, okay? All right, relax. So if I was doing that for real, I would go ahead and start like S1, L5, and I would do each position like flexion. I'd move up the whole spine before moving on to the next. I'm looking for gapping. I'm looking for even spaces within the spine. I'm wanting them to move equally and together. So that's just about most of what I'll look at in sitting. So after that, I'll go ahead and have you stand, Olivia. And can you go ahead and face away from me? Okay, so is it okay if I palpate back here in your low back? Yep. Okay, so I'm going to find her PSIS. There it is. Okay, so what I want you to do in a second is I want you to bend all the way down and try to touch your fingers to the floor, okay? Okay. Okay, and I can also look, so I kind of did 2 tests at one, so you can go ahead and stand back up. So by feeling your PSIS, I'm doing the standing flexion test. So I want those PSIS to rotate forward as she bends down equally. And I also looked at how far away her hands went when she went down to the floor. That's sort of a range of motion test for flexion, but also if she has more than 10 inches, which she probably honestly does, I'm just not pointing it out right now to measure, then I know that she's got some lumbar hypomobility going on. So that was the standing flexion test. That was the finger to floor test. I also could go ahead and do like the march test. So Olivia, I'm gonna palpate on your booty, okay? Okay. All right. So I'm gonna find the ischial tuberosity right there. And I just want you to bring that right leg up to your chest. And back down, good. So I'll do both sides, and I'm just looking for the issue. Okay, so the video cut off right as I was explaining that because I had too many pictures. So anyways, the explanation for that March test was I want the ischial tube to move forward and out equally on both sides. So now we'll go ahead and move to supine. So Olivia, if you could just lay on your back. Okay, good. So I'm also looking, also, I would have checked lumbar range of motion. We're both forgetting that today apparently. So while I was in that position, I would just have her bend all the way forward like I already did. I'd have her go ahead and do extension. She would put her hands on her side and side bend both ways. I'm looking for the fingers to be equal, and we would also look at rotation. I could just do a gross, like a percentage, or I could do, I could use a goni, or I could use an inclinometer. So if I use an inclinometer, I could bracket the spine. I could just do one. There's several ways to do it. None of them are particularly reliable. So now that she's in this position, Olivia, I just want you to go ahead and relax. I'm going to lift this leg up, okay? So I want you to let me know if you have any pain, and then we'll stop, and then you can describe the pain to me, okay? So if she's having pain on this right side, I'm just going to lift this leg. And actually feel some hamstring tightness right there. If she had pain between 30 and 70 degrees, that's a red flag for maybe some lumbar origination, some sciatic pain. So if she had pain and I wanted to be sure as to whether or not it was lumbar or hamstring, I could actually kind of drop the leg a little bit and then dorsiflex the foot. And I could also have her flex the neck. And if it recreates that sharp burning pain, then I know it's probably a sciatic origin because I stretched the sciatic. So also in this position, I can do the Faber test. So what I'll do is I'll flex the hip, I'll externally rotate, flex the knee. I'm going to put her in this position right here, and okay. And I want the knee to be about level, which she's a little bit tight, but not too bad. Olivia, let me know if you have any pain, okay? So I'm going to stabilize and just push down. No pain at all? Okay. So that right there, I'm looking for maybe there might be some SI or even some hip involvement. I could also do like the hip scour test if I'm trying to roll out the hip, where I would just pull her up into flexion, and I could just do a PA right there. I could also do, I could compress and gap the SI in this position as well to kind of rule that out because we're looking for a lumbar origin. Okay, so now Olivia, I just want you to roll right towards me. Good. So in this position, there's not as many special tests I could do. I could go ahead and have her do abduction of the hip because this is actually the proper manual muscle testing position for that. I can find the greater trochanter, move a little bit up, and go ahead and apply compression here. And I'm looking for provocation of pain for an SI issue. And also in this position, I'll go ahead and do a PIVM. So as hard as it is to do here, we're gonna make it work. Can you scoot towards me? Get those shins right up next to me. This would be easier with mobilization strap. I just want you to relax, and I'm gonna palpate your spine and move you around a little bit, okay? So I'll do the same, finding the right landmarks again. So maybe I start at S1 and L5, or I can do L5, L4, whatever. I'm gonna move all the way up anyways. I'll go ahead and do flexion, side bending, rotation, etc. So if I wanted to do rotation, I'm gonna gap around, and I would just drop her like this. Then not actually drop her. Okay, and that would be much easier in standing. Okay. Now Olivia, I just want you to go ahead and flip over your stomach. Okay. So once she's in this position, I could actually go ahead and do a manual muscle test for hip extension. I can do another SI test where I'm going to apply compression. So Olivia, I'm going to press right here on your pelvis. I just want you to let me know if you have any pain, okay? So right in the middle of the sacrum, I'm just going to apply PA pressure. Anything? Okay, relax. I can also look to see if this relieves any symptoms, because with some patients that might be another indicator. So the other test I could do here is I could do the femoral stretch test. So Olivia, I'm going to bring this back up and see if your heel can touch your bottom. She's a little tight, so I feel a little bit of springy. You good? You can feel she's got a little bit of hesitancy there. And then I can also test the quad length by fully.
It ain't long.
Not much there at all. Yep, she's pretty tight. It's popping up her whole hip. So I kind of already know right there. Where are you feeling that pain?
Front of my leg.
Front of the leg, so I know that it's a quad. And then, Olivia, is it okay if I lift up your shirt? Yep. Okay. So I'm gonna lift up the shirt. I'm gonna expose the low back. I'm gonna actually look at all of the spinous processes so I can see that they're aligned, which I also would have checked probably in standing flexion. She's pretty straight. I can palpate and see that they're evenly spaced, and I can also palpate musculature. So I'm looking at muscle splay. She's a little tighter on this left side right now. And then I can use her pain to kind of indicate where I need to go. And that would be it.